Well, that was an interesting first week of NFL football. Bunch of goose eggs, slow games. Who would have thought that the Jets-Steelers game was not one of those games? But in classic fashion, we still fell apart. But we are back for another week of the injury report, and man, I'm looking at this list and it is bad news for the 49ers. Starting with their star tight end, George Kittle. He was actually just placed on IR with a hamstring injury that he suffered in last week's game. He will then miss at least the next 4 games and will be reevaluated before that, which will be their week 6 matchup. So Kittle will be out until then. Another pass catcher that is now likely going to be on the injury report is Jauan Jennings, wide receiver for the Niners as well. He left with a shoulder injury. He had an MRI, didn't show anything significant, which is good news, and it's believed that he has avoided serious injury. However, it's still something worth monitoring, as especially with Kittle out, if the Niners are down Jennings as well, it's going to be a rough day for Brock Purdy in that Niners offense. Speaking of Brock Purdy, he popped up with 2 injuries this week with a shoulder and a toe injury. The toe injury is believed to be a little bit more severe, but it is expected that he'll be closer to an end-of-the-week game-time decision. If Brock Purdy is not able to go this week, Mac Jones is waiting in the wings to try and resurrect his NFL career. Now, finally, moving away from the 49ers, they've been hogging the spotlight a little bit. We have Brock Bowers, fantastic tight end out of Vegas there with the Raiders. He left the game against the Patriots with a knee injury. He was evaluated. He actually was asking to go back in, but the trainers held him out. I'd expect him to play. I don't see a reason why he wouldn't, but he's worth monitoring just to see if he goes into Sunday's game without an injury designation. Jayden Reed, wide receiver for the Green Bay Packers. Man, a lot of pass catchers on this list. He was considered a limited participant on Tuesday. He's coming back from a Jones fracture, which we're going to talk about a little bit later. But he saw his role decrease compared to last season in Week 1, primarily because it seems like they're trying to bring him along slowly and ease him into this NFL season. Even though he's a limited participant, monitor him through the week. I just still expect him to play unless for some reason there was a pretty significant setback. But like I said, we'll talk a little bit about what a Jones fracture is and what his progression looks like moving forward. Drake London, wide receiver for the Falcons, who are already down Darnell Mooney. He's considered day-to-day with a shoulder sprain that he suffered in that game against the Buccaneers there that the Falcons lost right at the end, unfortunately. But if Atlanta is without London and Mooney, that is going to be a really tough time for Michael Penix Jr. and that Falcons offense. Now, getting into a Jones fracture. Now, this is a very specific type of fracture found in the foot, specifically on your 5th metatarsal, which is that bone on the furthest outside of your foot that helps to make up that pinky toe. And if we're looking at the outside part of your foot, which is this view right here, the fracture will be right through here. So between the base of your 5th metatarsal and the shaft here, the body. And this is typically caused by a lot of load being placed on the outside of your foot, a twisting motion that occurs while that load is placed there, and is really common in athletes that are jumping, like basketball players, football players, even soccer players, but especially with repetitive stress, overuse, and even falls occasionally, or coming back to the earth after jumping. There's a bunch of different ways to manage it, and it ranges anywhere from immobilization with a cast and a brace all the way to different types of surgeries and internal fixations. Ultimately, it depends on not only how severe the fracture is, whether it's displaced or non-displaced, so if that the 2 pieces of the bone have moved away from each other and are not in the best anatomical position to allow for healing without some type of surgical intervention. But it also depends on what the athlete or patient is looking to get back to. So a lot of times for high-level athletes, they'll end up doing surgeries regardless, because one of the most difficult things with the Jones fracture is the risk of non-union. And what that is when the bone isn't able to heal properly because there isn't enough blood supply. So what happens is, typically with bone healing, as it gets to a certain stage, we look for something called a bony callus, which is surrounding the actual fracture. And that typically is around the time that we consider the fracture in the two pieces of the bone that have broken apart to be in clinical union. And what that means is that the bone is still not back to its pre-injury form, but it's now able to start to bear weight and start to do more activities not only of daily living, but then working towards eventually progression back to sports and athletic activity. Now, that bony callus then allows for the remodeling process to continue to occur through that bone. But the reason why that Jones fracture is so important to pay attention and look for that clinical union is that oftentimes it has non-union. So that callus doesn't necessarily form and that fracture isn't continuing to heal. The reason why surgery helps is that they're able to bring those two pieces of bone together and put them in the best position to succeed through that healing process. That's also why these types of fractures can take significantly longer, is because of the fact that there isn't as much blood supply. The healing process can and will take longer, but then also if there's non-union for that fracture in between those two pieces of bone, you're just continuing to push out that return to sport date. PT and rehab comes into this after you have that clinical union, as well as possibly before with some modalities to decrease swelling, things of that nature. But it's going to focus primarily on restoring that flexibility, mobility through that ankle to allow for full range of motion, as well as down into the foot, especially if they were immobilized or had a surgery. And then working on weight bearing, progressing to strength and stability, and then ultimately lateral movements, cutting, sport specific activities and types of movement that are going to put stress through the outside of that foot. So especially that side to side motion will put a lot of stress on the outside of that foot. So ultimately that's usually towards the end, along with jumping, plyo, a lot of impact activities that put a lot of stress through that foot. Typically, you're looking at 3 to 4 months for a return to sport activity. Ultimately, it also depends on, like I said, the non-union, but then also the type of interventions that were deemed necessary. But for Jayden Reed, he's obviously towards the back end of the recovery process. He played in week one's game. He had a decent game. I think in PPR leagues, he scored 13.5 points, something like that. But it's something to monitor because this can be a fickle thing. And the reason why they're easing him back in is because of the risk of non-union throughout the entire recovery process. But that is a little bit about what's going on with Jayden Reed and the Jones fracture. And that is week 2's injury report. So as always, make sure you comment, subscribe if you want to keep watching these videos. Put down in the comments if you're interested in any specific players. And let's hope for another great week 2. Hopefully some less injuries for the 49ers in particular. And I'll see you guys in the next one.